Bonjour. For those of you who don't know me, my name is Jill Andersen and I work for Red Lake Comprehensive Health. I've been helping with the fight against COVID here on the reservation for months now. And I don't know about you, but I suddenly feel like COVID just got real for our area. Initially this past spring, we had a lot of fear of the unknown. As it was working its way around the country, we watched it happening on the news, but it was quiet on our own doorstep and in our own area hospitals. Now, suddenly, we find ourselves in the middle of a citywide, countywide, statewide outbreak. Moreover, it's starting to get very real right here where we live. Our hospitals are nearing maximum capacity and flu season hasn't even hit high tide yet. The mix of COVID cases, along with those who are just unlucky enough to have to be in the hospital right now, has beds full, up and down the state and into our neighboring states. So here I am, asking you to be brave and strong and make smart choices. Now is when we need to think a few steps ahead of every decision to gather, visit, run errands, go to work, or go to school. We need to take stock of how we're feeling every day and honestly ask ourselves, if this is COVID, who could I be affecting with my decision to leave my house right now? We are working to keep up with testing, but as I've said in messages past, testing is a tool, but not a cure. Prevention, in addition to testing, is the best defense we have available to us right now. The symptom list has grown that we need to inventory daily. If any of these are a new or unusual symptom for you, things like fever, headache, shortness of breath, cough or runny nose, abdominal pain or diarrhea, nausea or vomiting, chills, sore throat, new loss of taste or smell, muscle pain or aching, then you need to make a choice. This is where it gets hard. Do I make a sacrifice and stay put if I answer yes to one of those symptoms? Is it going to be difficult or inconvenient in the moment? Probably. Will it hurt more if a few days later I find out my headache and sore throat weren't my usual allergies but were COVID? As a contact tracer, I can say with confidence that the answer to that question is yes. People have been feeling extreme guilt, sadness, desperation, and panic when we call them to start the process of asking who they had contact with during the time they could actively spread the virus. If you have any questions about symptoms, what you should do, please call our nurse line at 679-3912 and we'll help guide you. We're experiencing what's called community spread of COVID right now. What that means is we can't always find a definitive source for each case because too many in the community and surrounding areas have it, some with symptoms and some without. What we have noticed, what the CDC and Minnesota Department of Health have noticed, is that wearing a mask helps. Washing your hands and cleaning high-touch surfaces helps. Keeping your family circle small and work contacts small helps. Self-isolating when you feel sick helps. Avoiding gatherings, especially with people outside your household, helps. Overwhelmingly, this community banded together in March and April to take a stand against COVID. We're asking you to stay the course. Protecting people in this community is everybody's job. Be a COVID warrior. Miigwech.